title of the book after on the paperback because when I wrote it, she was in the middle of it. So
Oh,
yeah, it was originally called A Mother's Journey Through Her Daughter's Opioid Addiction.
okay.
And I didn't want to get too optimistic because when the book actually was finished, she was 3 days out of the last treatment center, and it was the last out of 40 treatment centers. So as one starts sliding into those double digits, we don't get too excited
Right.
about that.
Yeah.
But yeah, she's got a little over 3 years now. So
Awesome.
and as a matter of fact, everybody in the book is in recovery right now. Please God.
My
Yeah.
God, that's amazing.
It is, isn't it? Because I write that book and I talk about I mean, I was working with lots of people at that point, and there was lots of people that came into my lives that were like raring to go and needed a little help and need a little direction, or they needed some help with sober living. And I don't talk about them. I talk about the people that everybody gave up on, that even they gave up on themselves, that
Right.
it looked pretty bleak. And I always worried, I wonder, a year from now, what will happen to these people and what I'll be able to say when people ask me about it. But it's amazing. And one of I can't remember what I call him in the book, but he was a fellow that I picked up on the side of the road. He was actually the first person to introduce my daughter to heroin,
Mm,
and he's got a little over two. He's got 2 years today.
I
So
remember. I remember.
I just saw he had one short relapse, but now he's got 2 years again today. I just saw him post, so which makes me so happy.
That's amazing.
Yeah, so it's good. And
That's
it's like
great.
it happens. People, no matter how bad it looks sometimes, no matter how, you know, dire the situation, people recover. And that's why we can continue to do this. Otherwise, I wouldn't be able to get out of bed in the morning
Right.
if I didn't believe that. Right.
Yep, absolutely. And we did have somebody just join us on the webinar. So I
Awesome.
just want to throw out there, if you have a question, put it right in the Q&A button right at the bottom of the screen, and Maureen and I are happy to answer them for you. I actually, based on what you were just talking about, Maureen, I had something come to my mind. We had the group that I ran this week. We had a really long, in-depth conversation about the beginning of recovery and how hard it is for family members. So
Mhm.
I think oftentimes what family members think is that if they just get into recovery, if they just stop using, everything's going to be rainbows and unicorns. And then what I find is that once the person is actually sober and has gotten out of treatment, and I want to clarify that treatment and recovery aren't necessarily the same thing, right? Treatment is one pathway towards recovery, but recovery is when somebody is trying to abstain and doing work on themselves at the same time. So they're doing some sort of action step, right, to try to maintain sobriety and to change their behaviors. Where treatment is one way to do that. It's one modality. But what I've found is that when they first get out from whatever they have chosen to get sober, and they're sober and they're clean, families' anxiety actually goes higher than
Mm,
where it was when they were actively using. It's like an
absolutely.
unknown, and this floors my families because they're like, I don't understand. I must be losing my mind. This is what I've wished for so long. And I think it's so important we talk about this to normalize it so people don't feel like there's something wrong with them.
Right. I think that's so important because it is a feeling people don't expect.
Yeah.
It took me, I think, almost a year before I started to even take a deep breath because now I had a little taste of it. So now it was going to be even harder if she went backwards. And, people always say, oh, relapse is part of recovery. Relapse is not part of recovery. Relapse is part of the disease. When someone's in recovery, they stop relapsing. That's how we know they're in recovery.
Yeah.
So I think that this is my opinion, of course, and because I really feel like we have to stop saying that because it makes people feel like, well, I'm going to relapse eventually anyhow, which is what my daughter had drilled into her head because they had just first started saying that. So I feel like that's the same thing with parents. It's just like we keep relapsing, for lack of a better word. We
Oh,
stop
yeah.
taking care of ourselves. And then we start to hyper focus again, but in a different way on our children because now we have to watch them so that they stay in there because you know, and then we torture them and
Yeah.
make them feel like nothing they do is right. And
My term for that is warden of the addiction.
oh, I like that. That's good. Yeah, I was a warden. I was.
So was I. I was absolutely a warden all day long with
Yeah.
my ex-husband. That's what we do because it gives us a sense of control, right? And our lives are completely out of control. So if I can just control what they're doing and their behavior and they just listen to me, that's what I always say. If they just listen to me, then everything would be fine, right?
Yeah.
That's the way we feel.
I always thought I had some helpful special thing that I could say too.
Yeah.
So I said a lot of things, you know what I mean? And they were all really, really annoying, I'm sure. But I always thought that I would just say the right thing and all of a sudden the light would go off. And that doesn't happen like that. That's not how it works.
No.
You know, I was just pretty much irritating her.
Right.
Which,
Yeah. I mean, and it's typically, and from what I've seen, it's not necessarily words, like saying the words that matter. It's sometimes it's the lack of words that actually helps, the lack of control, like stepping back. I mean, I think words are always important and what we say really does matter. So saying things like, I love you. I know you got this. I'm, you know, I know this is hard and I'm proud of you for trying. Like those kinds of things, I think are really important, but that's not usually what we say.
no, it's not. It's like, why don't you do this? And if you did that and all that kind of stuff, instead of saying it no matter how many times. And I did, you know, I did a mixture of this, I'm sure. But now I know what, stepping back, I know what made the difference and what didn't make the difference because I get to talk to her about it now.
Yeah.
And that's, I mean, that's the one, you know, I don't claim to have all the answers, but I can look back on what I did and I can see what I did that didn't work. And then I get to have somebody tell me what they did that didn't
Right.
work,
Yeah.
which I feel very, very grateful for because that was not a given. And, but I really think that, you know, like you're saying, I believe in you, even, and I'm going to believe in you until you can believe in yourself, you know, things like that. I will love you no matter what is going on, that your sobriety is not, that my love for you is not contingent upon your sobriety.
Right.
And things like that, you know?
And I don't know if your daughter has ever had, ever had a conversation about this with your daughter, but one of the things I hear from people who are stuck in the grips of this is sometimes it would be nice to have mom just say, hey, how are you? What's going on in your life?
And
And
not talk
instead
about
of,
it. Yeah.
did you use, when was the last time you used? Are you withdrawing? Are you okay? Did like, that's, you know,
Yeah.
why don't you go register for classes down at the community college?
I always tell the story about the time that she came to go to treatment, and I decided that the good thing to do while she was withdrawing and on the fence about whether she wanted to go is to keep her busy by cleaning the garage. I swear to God, I know how crazy that sounds, but it made perfect sense to me at that time. I was going to keep her busy, you know, so she wouldn't think about the fact that she was withdrawing from heroin, which is, I mean, that when I look at it now, I see how absolutely ridiculous that is. But it seemed like the right thing to do at the time.
Right.
I mean, it just, I don't know. We're just so crazy. I was so crazy in the middle of all that.
We are, but I think at least this is how I am, and what I see sometimes is I do for other people what I would need if I was in a similar situation. So if I was about to say get admitted to the hospital for something that was scary and hard, cleaning the garage would be a really great activity for me to do to keep me busy and my mind off of, right? So for us, it makes sense. What we forget is we're not heroin addicts.
And we're not even if we were,
right?
Right?
True.
Yeah.
But you throw in the drug and the fact that their brains are completely hijacked by the drug. I mean, our brains are hijacked too, to a certain degree, but it's a different thing, right? So we always have to remember exactly what you just said. We aren't them.
Yeah, I know. And it would be so easy if we were, because we could fix it. But it doesn't work like that. It doesn't work like that. It's just, it's brutal, you know, it's just brutal.
Yeah.
But there's another side to this, and most people recover from it.
Yeah.
Did not make me feel any better when I was going through it, because I was sure that she was the one, you know, that I was the one, not necessarily her. I believed in her. I just believed that the way my life goes, that which is a terrible way to be thinking. But I was depressed. I was really depressed for a really long time, because here's your heart walking around outside your body and doing things that are dangerous and life-threatening. So I
Well,
mean,
and that's the thing. That's the real part and this is really hard to talk about. Um, but one of the things I've recognized in doing this work is we have to be real about that. People who are struggling with this, they're not just struggling, to make their kids' lives a little better. We're talking about life and death. Like there is a chance that your loved one could pass from this. And I think that's why your mind goes there, Maureen, because I've seen families that have to prepare themselves for that because it's just a reality that is there.
well, and I don't think that that's something, like we don't want to think about it, but I think it's something we need to think about, because I really do believe that you have to remember that this is a potentially fatal disease and that you could lose this person at any moment, and not to whip yourself into a frenzy about it, because like I said, most people do get past this, but we have to remember that every time we talk to them could be the last time we talk to them. So you don't want to say things or do things that are hurtful. And that doesn't mean you have to, you have to give in to every whim, or you have to let them abuse you or anything, or any of the other things that people who are very sick do. But I do think that you want to make sure that when you talk to your loved one who's struggling with this, the last thing and the first thing you say is, I love you. And that they know that no matter what, that you still are there for them. And that doesn't mean giving in to everything. Like I said, that's two different things.
Yeah.
But you can love somebody without
With
doing
boundary.
the things that they want you to do.
Absolutely. Absolutely. And I do think it's important to have both, to understand that it's a deadly disease, but also, like you said, to really understand that most people do get better.
Yes.
Right. So you can't give up the hope. It's okay to be real about it and hopeful. You can have both of those things exist at the same time. I think oftentimes we think we have to choose one thing over the other, but two
Absolutely.
contradictory things can actually be accurate at the same time. And I think both of those very much are.
And they have to. It's why we're careful when we get in a car, right?
Right.
I mean, we know that somebody could come around the bend and crash into us, but we can't drive around like that all the time. Otherwise, you'd never go anywhere.
Exactly. Yeah.
So
Very true.
we actually have a question in the Q&A.
Yep. Mhm.
Since I caught my teenage daughter smoking weed again, her father and I told her that we will be testing her whenever we feel we need to or want to. How much is too much? She is going on a trip, so we said we will test her before she goes and when she returns. But after that, how often should we test? And what ways can she mask the test?
Yeah, it's a good question. As far as how can they mask it, there are so many different ways. It's really hard to um, always be able to be on top of it, which is why how much is really probably, in my opinion, dependent on your anxiety and what you think is going on. So in my house, if I see something that feels out of the ordinary, it's a test. And it's a test like today, like right now, in this moment. You don't get to go to the store. You don't get to go buy your tea, or whatever it is that you're going to try to do to get it out of your system. We're doing it now.
Yeah.
Making sure you're standing outside the door to make sure. I think the more random you can be in testing, the better. And there's no arguing about it. It's just, this is what we're doing. There's no discussion around it. If she argues or she refuses, that should be okay. Then you're probably using. That's an automatic positive in my book. And then however way you typically handle it, whatever consequences you have formulated before, which, by the way, I think should be a discussion with her. I think the best way to handle that, and I know I'm answering questions that you didn't ask, but I love to talk about this stuff because it's so hard. I'm going through this with my son right now too. He's right at that age and I'm struggling with it. And I tell people how, or try to help people understand what to do. And then I struggle with it in my own life. So it's important for us to have these kinds of discussions. I invite him into the conversation. I don't want to punish him for smoking weed. I don't. I want to talk to him about why.
Yes.
Why are you doing this to yourself? What is the reason for it? What are you getting out of it? Usually they'll just say, Mom, everybody does it, right? Like, oh God, it's not that big a deal, but it is, because you're actually changing yourself in order to hang out with your friends. So what's the problem? Do you not like yourself? Is it because you feel cool when you do it? And I don't want it to be an argument. I just want to have a discussion. And if you are having trouble having these discussions with your child, then let's get a professional involved, and that can help you mitigate these discussions. I do this all the time. Obviously, let her develop a relationship with the person first, and then you come in and talk. A lot of these things we can't fix in a day, but getting her talking about her feelings and the why behind it is way important, because that could make a difference between this being teenage experimentation and something that leads to addiction. So let's get her talking. And again, the testing in my house, it's not a punishment. It's, I just need to know what you're doing because I love you and I want to be able to have these discussions. It doesn't mean there isn't consequences associated with a positive test. So there are consequences, but those consequences directly fit what he's done. So, you know, if it were weed in my house, it would be, okay, well, now I don't really trust. Now I'm scared. So because I'm scared, I'm not going to give you $20 to go down to the store with your friends because I don't know what you're buying. So I'm not going to allow you to have any cash that's mine in your hands. I'm going to want you home at night. There's not going to be me dropping you off or picking you up or letting you stay out until 11 or 12 because I'm scared and I need to feel better. So it's about me, not necessarily him. It's about my fear. So the consequence is that I no longer trust you. And because of that, now you need to be around so I don't feel anxious. Right? Because what we tend to do is we're like, well, you did something bad, so no, you don't get to go out. And it's all about them. And that's when they rebel and they get angry and they're like, you don't trust me and all that. And my son and I talk about trust all the time. No, I don't trust you. First of all, I don't trust you because you're a teenager. And that has nothing to do with who you are. Okay. Like you are teen. You are 14 years old, dude. So I don't trust you at all because it's a 14-year-old's job to push the boundaries in life. And that does not make you a bad person. It's just real, right? And you can gain my trust and earn my trust, but that's up to you. You're the one that has to do that. You need to make good choices in your life in order for me to trust you. And it's okay to make mistakes. Own up to them. Let's talk about it. There may be some consequences, right? But it's not my job to trust you. It's your job to earn my trust. You have anything to add, Maureen?
It was exactly what I was thinking as far as, the why. Let's look at the why. Why is this necessary? But also because so many young people are saying, well, it's legal now. It's just like drinking. And what are you making a big deal about it? You're just trying to control me. And I mean, I think we've all heard that as parents, right?
Oh, absolutely.
Especially teenagers, you're just trying to tell me what to do. You're just trying to control me. And I think that, or you smoked pot when you were a kid, maybe, I wouldn't suggest sharing those things with somebody but some people do. But the pot is different. The marijuana is very different than it used to be. And I would then say, I think we owe them the reason why. And it's not just because we don't like it and we don't think we should, because there's an actual medical reason why. And it's because their brain is still developing, and that changes, and any kind of drug changes the functioning of the brain. And we might want to educate them. And I love Ruth Pody, and I know that do you have anything on Herren? Because I always recommend Ruth Pody. Talks about marijuana in particular. She has a whole
we don't have anything specific to marijuana. We do have some stuff on teenagers and brain development and things like that, but not.
I love her. She talks specifically about how marijuana affects the brain. And I think it's Ruth Pody, POTEE.com, but you can just look her up on YouTube. And she's got some really good information out there about how marijuana affects the developing brain. And maybe if to put that out there and say, this is the reason why we feel like we need to do this, and this is also the reason why you might want to make different choices as well, because this is going to affect you for the rest of your life, if potentially. So let's take a look at why I don't want you to, and then let's go from there. And I don't know, maybe 1 in 10 that'll change the
Right.
the reason why, whether they do that or not. And maybe it won't, but it's worth a try.
Yeah, absolutely. And I think the gateway aspect of it is important as well, because that's one thing that kids don't think of that. This is the problem when we're talking about teens. Their brain isn't fully developed yet. And the area of their brain that isn't fully developed is the area that mitigates risk. Okay. So think about that. We're literally wired at 16 years old to move towards risk. Okay. Our brains are not capable of saying, ooh, that's hot, don't touch. I mean, it is when it comes to something that's, obviously tactile, but they don't see themselves as having or being able to die. They really don't, right? They're invincible at that age. And there is neurological reasons why. So when we're adding in substances, we're not thinking about the risk at 16, 17, 18. It gets better 19, 20, 25 is really when it's pretty fully developed, that ability. But now we're managing emotion with a substance before our brain is even fully developed. So now as we get older and things are harder and our emotions it's not that our emotions get bigger, but the consequences get bigger, right? We're going to need something maybe stronger than marijuana to have the same effect that it had when I was 16. So we're teaching our brain, or I should say, actually, we're not teaching our brain to manage emotions on its own. We're not learning coping skills. So therefore, going forward, you're going to need the drug or some kind of drug in order to manage your emotions because you're not learning that. So that's another really important aspect of it.
I love the way you put that. That's great.
And on top of that, I do know, obviously I'm a little geeky and I do know about the brain. And what I learned about marijuana is that the cannabinoids in it, we have cannabinoid receptors in our brain. Okay. And we don't typically talk about the cannabinoids as being an issue because it's the THC that gets us high. But for a teen, the cannabinoids are involved in the wiring. Okay. So the cannabinoid system is what helps those cells connect to each other in some way. Okay. So when we're adding cannabinoids from outside into our brain, it can actually change how the brain wires. And we don't 100% know exactly what the consequences of that are. We don't have all the science. I'm sure there's some neuroscientists that could explain it way better than me. But basically, at the end of the day, you're putting into your brain the thing, one of the things that helps your brain actually wire together and develop. So we can short circuit that. And I love, Maureen, how you added, it's different today, because oftentimes my kids will say to me, but people smoking this for years and nothing happened to them. I mean, it did happen to some people, I argue. However, there's a 1-to-3 ratio of cannabinoids to THC 20 years ago. Okay. When it was just sort of a natural thing. Now it can go up to 1-to-30, sometimes even higher.
Amazing.
That's a huge, huge difference. So we're not talking about, your grandmother's marijuana plant anymore. We're talking about something that probably isn't even really marijuana anymore. It's something totally, it's kind of like, and this is the way I always refer to it. When you go into the store and you see the apple that's the size of a grapefruit, that's not really an apple anymore either, you guys. Like, we're genetically altering all of these things. It's not the same. And also, to throw out there, the synthetic marijuana can be upwards of 1-to-300. So thankfully, people are having trouble getting their hands on that now. It really is, they're really have locked down on it, but there are still some states where you can find it. That stuff is really dangerous. But at the end of the day, the thing that seems to get through to my kids that I work with the most is that it's making our young people psychotic. So we didn't have that. When I was a kid, nobody I knew that smoked pot ended up in a psychiatric ward from being psychotic. So the new marijuana is actually making, it's in our younger kids are most at risk. And it's probably because of what we're talking about the brain. They typically come back from it, so they don't stay psychotic forever. But it's really scary at 15 years old to end up on a psych ward for 2 weeks because, you smoke too much marijuana and your brain is completely, off the wall and you don't know reality anymore. That's traumatic. So that's the one thing that when I tell teens, their eyes seem to light up and they start to actually get nervous about, like, it's a serious drug now. And I also want to throw out there too, because this seems to surprise people. I don't see marijuana as different from alcohol. I never really did. So we need to be cautioning our kids just as much about alcohol as we do about marijuana. They're both very dangerous substances that when you're 40 years old and you already know you don't have a substance issue and you can have a glass of wine or have a couple, edibles and then go to bed, is that super dangerous? Probably not, right? But to a 16-year-old, it's a completely different ball game. So they need to know the difference. They need to know the difference between an adult whose brain is fully developed, who has never had an issue with a substance, having a glass of wine at the end of the day, which, by the way, we all still have to admit isn't the best choice, right? Like there are much better choices out there, but it's probably not going to derail that person's life, where at 16 it actually can.
Great. Excellent. Beautiful.
We have another question from Facebook. I stay highly stressed because my adult son is trying and he seems to try to make me mad all the time. How do I refrain from that and the confrontation? Yeah, I'm going to give this one to you, Maureen.
No. I mean, I always want to go to the why. Why is he doing that? There has to be a reason. Is he so frustrated with his own life that he's taking it out on mom? And what's the pattern there? What does she typically do? And what, not that it's her fault, but what have we set up in the past that makes him take it out on her all the time? And there must be some dynamic there that she's got to change. How does she refrain from that confrontation? She refrains from that confrontation.
Walk away.
I always, I'm a big fan of having a script. This is the thing that I do when you do this. And after a while, it becomes boring to them. You know what I mean? That if when you poke at me in this certain way and you say this thing, if I say to you, this is one of the reasons why I'm going to walk away right now, and this is why. And if you do it consistently, it becomes boring. They're just not going to do it anymore.
Right. And I think my question is A, does he live with you? B, is he actively using? And C, have you become the warden of his addiction? Mm-hmm. Because that right there, those three things are a prescription for exactly what you're talking about. If you are living in the house with your adult son who is using, and you're trying to control that use, this is what we see, to the point where sometimes people get hurt. I mean, they're not in the right frame of mind, and they're trying to protect the addiction, because that addiction, that whatever their substance of choice is, has become their air. And I often say to families, like, how would you respond if somebody was trying to take away your air? You'd fight and scream to keep it. And that's where their brain is. Even though it's not logical to us, their neurology is really sick. And that's what their brain truly believes, is that this drug is keeping them alive. And then throw in there that detox feels like you're dying. So it even reinforces that it is keeping you alive. So that's what they learn. And then we come in and we try to control it, and we try to control their use, and we try to control their behavior. And they got all this already going on, and they're not of sound mind. And it's very easy. They want you to go away. So they are going to do everything they can to get distance between you and them because of the control. And this is honestly where people end up getting hurt. So I would say, be careful, hold him accountable for his behavior. If he is getting out of control, please call the police. I know mothers never want to call the police on their child. I don't either, but please protect him from hurting you, because that's what's actually going to protect his recovery. If he hurts you, you are causing way more trauma, or you're not causing it, he's causing it, but he's causing way more trauma for himself. And then he has to wake up sober someday and face the fact that he hurt you. So if by keeping him safe from that, keeping you safe from him when he's like that, actually helping him. So please try to remember that, and please keep yourself safe. When somebody is using drugs, they are not the person you know. That person's still there, but in that moment, they are not that person. You cannot trust them. And every single person I know that gets into long-term recovery, and I'm sure Maureen's daughter has said something similar, will admit to that. That wasn't me. I wasn't safe.
Right. And, I always tell people that lock up the jewelry, protect yourself, do all these things that you would never do with your own child, or this particular person, because you don't want them to have that trauma of having, you don't want them to in addition to all the other things, you don't want them to have to recover from the trauma of whatever they do when they're not themselves. And I wish I had done more of that. But I was looking at my daughter instead of looking at a person who was really consumed with the addiction, and it's hard to reconcile those two things. I'd be curious to see what else is going on there, and whether he is living there and all that. If, I always tell people that if they're really intent on having somebody who's actively using in their house, they need to look into craft, because craft is a very good way of dealing with somebody that is actively using. Now, I'm not suggesting that that's the right thing to do, but if for somebody who feels very strongly that they're going to have this person in their house regardless of whether they're using or not, I think that craft is a really good approach, a craft trained therapist, or that approach to making sure that you're safe and not confronting someone when they're high. It's just a bad idea.
Yeah, totally agree. Couldn't agree more. And I do think that is a really appropriate use of craft. I do like craft. I also like to throw out there, though, that for most people that are in more late stage addiction, so people that have been at it for a while, craft typically doesn't lead towards recovery. So if somebody's more in the early stages of addiction, I think craft is an awesome approach. But once we get into like people who have been using for quite some time and their neurology is really sick, really the use for it would be more to keep everybody safe than to actually think it's going to move towards addiction. And I only say that, I wish it worked, because I see it and I think it sounds so awesome and it looks so awesome, but
I'm craft trained and I agree with you.
Yeah,
I think that's the appropriate use for it right now with what we're dealing with.
Right.
30 years ago, when it was mostly, when that started, it was mostly women that were trying to get their husbands to stop drinking, and they were dependent upon those husbands. So they weren't going anywhere. So this is like, it was a whole different way but I think that it works when you've just decided you're not going to have them leave.
Yeah,
And
right.
I think
Absolutely.
that's
Yep.
appropriate. And I like the way it teaches people to talk to people too,
Mhm.
that are in the middle of that. So, I've taken like things out of it, but I totally agree with you. I think it's not really appropriate for somebody who's, consistently using heroin. So we have another question.
Yep.
How fair is it that I've told my boyfriend that if he relapses, I cannot be with him anymore? I feel this way because, for one, I know there is a high likelihood that if he relapses, he may not survive, and that scares me. But I also cannot have him around my children if he is using.
I think whatever you need to do for yourself is fair. This is a really hard thing to be in, and you don't have to be in it. And it sounds like you've probably already gone through hell. And it is okay to decide that you don't want to do it anymore and step out. I think saying things like, if you really love him, just doing it with love and compassion, but letting him know that this is, that you are just depleted and you can't be in this anymore. You can't go back there. Just be careful about making ultimatums, because I feel like that's typically how we do it. And trust me, I was the queen of ultimatums. I told my ex-husband that I was going to leave him all the time, and I would pack a bag and I would leave and I would come back probably before the end of the day. So we got to be careful with that. So if you're going to say those words, if you're going to say I'm leaving, make sure you are ready to follow through on that if he does relapse. And when I say leave, by the way, I don't necessarily mean leave forever. I just mean space, like we're taking a break, and actually remove yourself from him until he gets himself back into some form of recovery. Because what we do when we do what I did for many years is we reinforce that it doesn't matter what we say, and there's never going to be an actual consequence. So then they can do whatever the heck they want. It got to the point where my ex-husband would be like, peace. Like he wouldn't even have a reaction when I left, because he knew I was coming back until I didn't. And by the time I got to the point where I left without coming back, there was no coming back. There was no way, there was nothing that could happen that would bring me back. So I often say, if you can do it, try to do it before you're to the point where you're really, really, really done. Try to take that space and allow them to work on themselves before you're ready to end the relationship altogether, because sometimes, not for everybody, but sometimes that can actually motivate them to do the work that they need to do. And it did with my ex, but unfortunately I was done.
Yeah. I mean,
So,
you never want to talk in absolutes when
right,
you really don't know what you'll do when that happens. Even
right.
if you think you do, you don't really know.
True. Very true.
So, I mean, somebody could make a mistake, come to you and tell you I made a mistake and I'm gonna, I need to do this, that, and the other thing. And that may be part of their recovery. And are you gonna leave because of that? So you don't want to set somebody up like that and feel like they have to live in fear of their own disease, because this is part of this is
It
part
is.
of it.
It is. Absolutely.
Um,
Right.
I think that but for yourself, you're not gonna live in a relationship where you don't know if the person's coming home, if they're stealing money, if they're gonna overdose, if they're gonna die. That's not how you want to live, and that makes perfect sense.
Yep.
So if somebody is gonna do that, now as long as he lives, there'll always be the chance that he'll go back.
Mm-hmm. Yep.
So things could happen even if they're not currently using. So this is a decision you have to make as to whether you want to be with somebody that has this disease, just like you would want to not, maybe you'd say, you know what, if somebody had cancer, I can't live with that. That's something I've been through before, and it could always come back. So I just don't want to be with them. We would never say that. You know what I mean? Typically, we would come around the person, but I think what she's probably talking about
Is
is
a
the
run.
lifestyle and the lying and all that kind of stuff that you're not ready to deal with. But
Right.
you may have to deal with at some point somebody feeling like they're going backwards, and that they need more help, and hopefully you have an open enough relationship for them to come to you and say that. I know that, my daughter occasionally will say, Mom, I've been having some dreams and I feel like I want to use again. And we'll talk about it. And she's always like, apologize, I'm sorry I'm putting this on you. It's like, okay, make another an appointment with your therapist. There's some things you can do. What other things you can do? And let's talk about how normal it is to feel like that occasionally. And that it doesn't mean you're going to do it, and to have that conversation. And then I, get off the phone with her and I cry a little bit because I'm terrified. But that this is part of somebody who has this disease.
Yeah, absolutely. And I would like to qualify too. When I hear the word relapse, in my mind goes straight to the behavioral aspects of relapse, not necessarily the use of the drug. And I'm not saying that the use of the drug is okay,
No, I agree.
but just recently I was working with somebody who had been sober for a decent amount of time. His drug of choice is alcohol. He went to his mother's birthday party and ended up having 2 glasses of wine, and then was like, oh my God, I can't believe I did that. I got to get right back on. Like, I can't do this. And he did all the right things. He reached out to his support system. So is that a relapse? Yes. Is it necessarily the kind of relapse that has a ton of behavioral components to it? No. It's somebody who's working really hard towards recovery and in a moment made an impulsive decision, and regretted it and then got himself right back on track, right? Versus the person that just goes and they have the drink and then they have 6 more drinks and then they get a bottle of vodka the next day and they're right back in it, and now they're lying and they're stealing and they're right. Like, those are 2 different things. And I know those are the 2 extremes. A lot of times it's more in the middle, but you got to look at the behaviors associated with it as well. Right? So you get to decide what you're going to invite into your life, right? So where your boundaries are. If it's 1 drink for you, that's okay.
Right.
But figure out where and what, and think about the behaviors too. We have a tendency just to make it about the drug, but what kind of things has he done that maybe he was using or drinking at the time, but what are the behaviors too that are associated with it that you won't tolerate anymore? Write those down and add those into the discussion that you're going to have with him.
And to have that discussion and be clear about it. And also to be clear that it has nothing to do with how much you love the person.
Mm-hmm.
You have to love yourself a little bit more than, when you're in a relationship, and you have to take care of yourself. Otherwise, you can't take care of anybody else either. So I think that, to have that, sit down and have that conversation and make it a conversation, and have them, say, how do you feel about that? And have it go back and forth rather than it be this big screaming match when something happens.
Yep, absolutely. I'm going to give you this one, Maureen. Will you explain what craft training is?
Craft it's a way of, it's a therapy modality. It's really
Harm
not,
reduction typically is what we
yeah, and an intervention method, kind of, sort of. But what I don't like about it is it's typically taught to parents, and it turns them into therapists.
Mm.
So that's what I don't like about it, because you shouldn't have to be your loved one's therapist, or your child's therapist. But it's a very loving, kind way of dealing with somebody who is struggling, or who is using, and it's more complicated than that. And if anybody wants to know about it, actually, there's a website called Allies in Recovery. There's books out too. Robert Myers started it. That's who I trained with. But there's a website called alliesinrecovery.net, and they have they have 12 videos on how to do craft, kind of. But again, I feel like it's helpful to look at that, to find new ways of talking and new ways of dealing with your loved one. But I think it's dangerous, because it sets up this thing where now we're the therapist, and they're the and they're our patient, and now we're becoming the warden of the addiction again. So I think that when someone really doesn't know how to respond to somebody who's in the middle of this, or they're really at a loss for words, and how to take care of themselves, and the person is in the house with them, I think it's a good thing to take a look at. But I really have a problem with how it turns the parent into the therapist.
Right. Yeah. And again, I want to throw out there that I think it's really great for if you're struggling, like, the woman earlier with a teenager who is smoking some marijuana, and you're trying to figure out how to deal with that. That's a good approach for that.
Yeah.
That would really be good for you to look into.
And they have, I'm sorry to interrupt, but they actually have one aimed at adolescents too, a craft model aimed at adolescents that you can read about,
Right.
And I read as much as you possibly can. It doesn't mean it's all right. You can always take a little bit of this and a little bit of that and a little bit of that to, put into your, this is my approach to my loved one's addiction.
Yeah. And I actually think you should do that, because there's so many different approaches to this, because there's different people, and different people respond to different things. And this is why we say many pathways to recovery. And the more you learn, studies have proven this, the more you learn about substance use disorder, about modalities that we use with substance use disorder, about the neurobiology behind substance use disorder, the higher the chances are that your loved one is going to end up reaching out for help at some point and find their way to recovery. It really shows when we do work, we actually can then help guide them. It's just figuring out how to do that, which typically is us taking a step back and just loving. But, the more the better. So look into all of them. And there, and like I said, I think craft is a great thing for people who are struggling with people who are just starting in the substances. I think it's a great model for that. I think it can really be very helpful there.
Yeah, I agree.
And I do agree that when it's somebody who's like, in your house, I had a mother who used craft for years with her son, because she had so much trauma. She was an ER nurse, and she had so much trauma that she could not ask him to leave. So she became very well versed in craft, and it helped her quite significantly survive, the time where he was in the house with her. But there's also a downside, because she's sleeping outside his bedroom door at night and checking his breathing throughout the night. She didn't sleep for like 2 years.
Yeah.
So,
and I know parents like that, and having their child leave, or having their loved one leave, is not an option. So therefore, I always tell people, I know this is part of, where this comes from. Take the door off the hinges, put a shower curtain there, so this way you can get in. Do the same thing for the bathroom. Who wants to live like that? You might ask, but it's a reality, and you know, this person may die, and or you may have to go in suddenly, and what a horrible way to live, but that's an individual decision.
Yep. And at the end of the day, most likely it's your house, and you got to take your power back in some fashion, because usually they're running the shots because we're afraid of them, and we're afraid we're going to trigger them. And if we trigger them, they're going to use more. It doesn't really work that way. So,
But nobody can tell you that when you're in the middle of it.
no, I know it's hard to hear,
Yeah.
right? Especially since they're typically reinforcing that, because again, their goal is to get you to back off so they can get their air, right? So, and I say it like that because I feel like it's so stigmatized that I want us to think of it a little bit differently. Not that they're too weak to stop, but they're fighting for something like air, because that's the way their brain views it, right? So we got to be careful, and we have to put the boundaries in place that we need, and not be so afraid of their reaction to it, because that's what's going to lead to more health and more functional, interactions, rather than us getting to the point where we've stuffed so much of it that we explode and we call them losers, and whatever else happens to come out of our mouth, usually bunches of F-bombs. Not at all talking from experience here, but that's typically what happens, and that actually feeds the illness instead of feeding wellness. And I'm not by any means saying it's your fault, because it's never our fault that somebody uses drugs, but we can definitely do things to make it better for both of us instead of living in a war zone.
And it does turn around, and that's why I mentioned that my book is available in the library, so I'm not trying to sell any books.
And it's awesome. And I'm not trying to help her sell books.
But I can't, it's very hard for me to even read, because sometimes I'll do readings and it's very hard for me to even read the book, because it was so painful, and it's so like amazing to me that I'm in such a different place now. I mean, even when I imagine things, okay, it can always get better, it can always turn around, I would tell myself that all the time. I never imagined things would be as good as they are now. So I just want people to understand that that can happen. And it's not the odd one out. I see it happen all the time.
Yep.
I'm doing this long enough, you know what I mean? You start to see the success stories later on of people that, are inviting me to weddings and showing me baby pictures and college graduations and stuff. And they're just amazed that they're there. And it's like, yeah, I kind of thought this would happen eventually, but I'm so happy for you,
And when it happens, let us know, because there's nothing that makes my day more and helps me get through the tough stuff than when I get a picture from somebody that I worked with that was struggling so bad, and he's got 2 beautiful children and a wife and is working towards a degree. And there's nothing that helps me so much get in there and stay in there in the depths of this. So let us know when you are doing good, because it really happens frequently, and it's so nice to see and so nice to hear. And don't disappear either. I just had a woman who came to my group for years. Right. When she came to my group for years, and now her son he's in recovery, and he's been in recovery for about 1.5 years. And she just decided to pop back into one of our groups one night just to say hi. She hadn't been there in, probably almost a year. And now she comes every week, and she comes to help the people who are struggling, and she gives them so much hope, and she gives them advice, and it's been so powerful. So, we need all of
us too.
Yeah.
Because people think, oh, they probably don't remember me. Oh, trust me. I remember. Yeah. Yep. I remember you. It may take me a minute to put the name and the story together, but I remember, and I've been in the back of my mind worried about you because you disappeared.
Right. Absolutely. Absolutely. Yeah. And I, by the way, will probably never remember your name because I'm awful with names, but all you have to do is tell me the first 2 seconds of your story and I will remember everything about you. So. Okay, you guys. Well, thank you, Maureen. It was so nice to have you on, and we'll be back here first Tuesday of next month. Doing this again, and we have
coming up. Yay!
I know.
For January. Yay!
Yeah, I know. We're through one of the worst months. We just got one. I want to thank you both and all the Herren Project for all the help and support you provide. It has inspired me to go complete my degree, and I'm working towards a degree so I can be part of the community, helping those and families that are affected with substance use disorder. Oh my God, I love that. Thank you. We love that.
All right, now I'm done. I'm going to bed, so nothing else.
I know. Then we're going to end this on a good note.
We're going to end the day.
Bye, Maureen. Thank you, guys.
So long.